Now, the different infections that is acquired in healthcare facilities. So what are the different, these are called hospital acquired infections. So how do you prevent the hospital acquired infections? By surveillance, by prevention and control measures, by isolating techniques, standard precautions, transmission based guidelines. No, then infections in immunocompromised host. Now, what are the infections in immunocompromised host? This is a very important topic. That is the infection in the cancer patient, then the different skin infections, cellulitis, macules, papules, then catheter related infections, then upper GI infections, that is oral mucositis, oral candidiasis, all these infections, candidal infection, then chronic disseminated candida, especially in immunocompromised patients, hosts the maximum infections are the candida infections. Then what is febrile neutropenia? So all these topics you have to cover so that you can solve the MCQs. Then infections in the transplant recipients, infections in the transplant people are also immunocompromised because we give the immunosuppression therapy. Then the different infections in different transplant patients, then solid organ transplantation, then infection in immunosuppressed patients, suppressed patients. Then what are the different vaccinations to be given to the transplant patients and the cancer patients? Any example is the hepatitis A vaccine, hepatitis B vaccine, quadrivalent meningococcal vaccine, influenza vaccine, measles, mumps vaccine, all these things. Then coming to the infective endocarditis, a very important infection which is important in cardiology also, here also in medicine also, and it is asked in the pathology also, and it is so this infective endocarditis topic you have to be thorough. So infective endocarditis, the epidemiology of infective endocarditis, then the microorganism which cause infective endocarditis. Nowadays they are asking about the HACCP group of organisms. HACCP group of organisms, infective endocarditis, then the clinical manifestations, then the modified Duke's criteria for clinical diagnosis of infective endocarditis regarding the blood culture and all those things. So then the antibiotic treatment of infective endocarditis, the drugs which are used for methicillin sensitive infection, methicillin resistant infection, which antibiotics are used. Then for has a group of organism, which antibiotic is used. For Coxiella burnetii, which antibiotic is used. For Bartonella infection, which antibiotic is used. Then they can ask about the timing of cardiac surgical intervention patient with endocarditis. When you do the surgery in infective endocarditis patients, what is the timing? Then the standard regime for the prophylaxis of infective endocarditis. So these topics you have to cover in the detail so that you can answer the MCQs. Then comes the intra-abdominal infections. Now what are the different intra-abdominal infection? Peritonitis. Especially the most important topic is the spontaneous bacterial peritonitis. Repeatedly asked, the organism causing spontaneous bacterial peritonitis. Then secondary peritonitis. Then peritonitis in patients who are undergoing the dialysis, that is peritoneal dialysis. Then different intra-abdominal abscesses, intra-abdominal abscesses, intraperitoneal abscesses, then the visceral abscesses. The visceral abscesses include the liver abscess, how it is drained and what are the antibiotics given. Then the splenic abscess, which is a very fatal condition. Then renal abscesses and perinephric abscesses. These are the intra-abdominal infection. So we have to deal with the infection acquired in healthcare facilities, the infection acquired in immunocompromised hosts, and in the infective endocarditis, then the intra-abdominal infection, which includes the liver abscess, splenic abscess, kidney abscess, all those things, nephric abscess. Then comes the sexually transmitted and reproductive tract infections. Sexually transmitted and reproductive tract infections include which pathogens? What are the different pathogens which cause the sexually transmitted infections? Can you, if you know any of them, you can type in the chat box the different infections caused by the sexually transmitted infections, which organism cause. So we know the gonorrhea. So we must know everything about the gonorrhea. Then the vulvovaginal infections, then epididymitis, then urethritis, gonococcal urethritis and non-gonococcal urethritis. Then the pelvic inflammatory disease. Pelvic inflammatory disease is important in obstetrics and gynecology. Definitely one question will be about the causative organism of the pelvic inflammatory disease, PIDs. Then ulcerative genital lesions, then proctitis, proctocolitis, enterocolitis, and enteritis, the organisms which cause the proctocolitis and enteritis. Then the gonorrhea must know that treatment of choice for gonorrhea, first drug of choice for gonorrhea. Then chlamydia trachomatis, then mycoplasma, again it is a sexually transmitted infection. Then syphilis, primary syphilis, the secondary syphilis, the manifestation of secondary syphilis, primary syphilis. Then congenital syphilis in pediatrics, it can be asked, and it is important in gynecology and pediatrics both. Syphilis. Then herpes simplex virus infections. Then donovanosis. Then HPV infection, very important, the vaccines which are used for preventing the HPV infection, and what are the lesions caused by the HPV infection. Then infection of skin, soft tissue, joint and bone. This is important in orthopedics, especially orthopedics and dermatology. So the infections which are animal bite infections, they can ask. Then bacillary angiomatosis, herpes zoster. One MCQ definitely comes from this MRSA skin infection, the drug which is given for MRSA skin infection, the primary treatment and alternative treatment. Then gas gangrene, very important topic in microbiology, surgery also. Then necrotizing fasciitis, a very important topic in surgery as well as surgery, it can be asked. Gas gangrene, necrotizing fasciitis. Then cellulitis, the organism causing cellulitis. Then necrotizing fasciitis. Then myositis and myonecrosis, and infectious arthritis. Then osteomyelitis in orthopedics. Then knee joint infection, knee joint effusion. Then the different organisms causing these infections of the bone. Then the acute osteomyelitis in orthopedics, chronic osteomyelitis in orthopedics. Then comes the pneumococcal infection. Pneumococcal infections are very important, especially when you have removed the spleen of a patient. So these pneumococcal capsulated organisms are more common. So the streptococcus pneumonia, then meningitis caused by streptococcus pneumoniae, then non-invasive syndromes, then pneumonia, meningitis. How to prevent these infections, pneumococcal infections. Then comes the important one is the staphylococcal infection, repeatedly asked. Staphylococcal infection, especially the staphylococcal infection caused by coagulase negative staphylococcal infections. Then staph aureus, everything about the staph aureus. What are all infection it causes? The bacteremia, sepsis, infective endocarditis, respiratory tract infection, musculoskeletal infection, then MRSA infection, methicillin resistant staphylococcus aureus. Then toxic shock syndrome in gynecology, it can be asked. Then the different types of drugs which are used in staphylococcal infection, again important prophylaxis for the pharmacological part. Then comes the